All right, so the last thing I want to talk about is position. Um, Actually, there's another piece we're going to tag onto this, but the original 4 P's, the last P is position. And we've talked already about how the presentation and position of the fetus can affect progress and success in labor, but also the position of the mother. So there are some position changes that we can make to help promote getting that baby out. First of all, changing positions frequently during labor helps relieve fatigue. It improves comfort, improves circulation. So just being able to move around in labor decreases pain perception. It makes labor less painful. Also, if we are trying to make labor go faster, we can use positions that we can encourage positions that use gravity. So if the pelvis is upright, the weight of the baby is going to dilate that cervix more easily. If we have someone who's progressing really, really rapidly, we can actually put them in a side lying position to slow things down. So gravity can help speed things up. We definitely want to keep them off the back because remember the vena cava. If the whole fetal weight is on the vena cava, it traps blood in the lower part of the body. And so we end up with not enough blood getting back up to the mom's head for one, but also it can drop blood pressure, and also it can cause fetal distress. Positions that allow the pelvis to move more freely. Remember, those joints relax, and so the pelvis can move around a little bit. Positions that allow that may help facilitate the twists and turns the baby has to make to get out. So a lot of times more upright positions may help with that, and out of bed type positions, or squatting, using a squatting bar, using a birthing ball, yoga ball. Sometimes in early labor, if the baby needs to move down some, going up and down steps can help. Just changing positions that can help move the baby. Think about getting settling things down in a pickle jar. We want to just get the baby into the right position, and moving the pelvis around can help with that. There are some positions that allow for descent and rotation in specific circumstances. And probably the best and easiest example, if a fetus is in occiput posterior, okay, that means they're face up because the occiput is pointing at the back, it can actually be harder to get the baby delivered. Okay, I'm going to use my hand. So occiput anterior, the baby's head flexes, ducks under, delivers. Occiput posterior, it actually can get stuck on the pelvic bone, and we've got to get the pelvic bone to change position to get the baby delivered. But if we get that mom having, sometimes we recognize someone as occiput posterior because we can feel the fontanelles on exams, and sometimes they're going to complain of back pain, and labor can stall out. They get to around 5 or 6 centimeters. They just kind of get stuck and stay there. So if we see indications of that, sometimes getting that patient on their hands and knees, that can take support, and it can take a lot of support and help if it's even possible, if they have an epidural. But if we get them on their hands and knees in a supportive position, have their partner or their labor assistant, whoever's there with them, their support person, use a fist to put pressure on the sacrum with contractions, because that's where that pain is. The counter pressure helps with the pain, but also that position can help encourage the fetal head to turn, help encourage the fetus to turn into an anterior position. And I've actually seen this work more than once with patients who stalled out about midway through labor because the baby was face up. Okay. The bonus P is psyche. So I want to talk a little bit about mental state and labor. Stress actually can affect labor and birth. First of all, labor is an anxiety provoking experience. People who are in labor tend to have anxiety because they're worried about how painful is it going to be. am I going to be okay? Is the baby going to be okay? You know, it's an unknown experience. Even if you've done it before, you don't know what's going to happen in this labor. So anxiety is very common and normal, but we may also have stress from other sources that can affect labor and birth. When we have a really strong stress response, we have a stress response, we produce catecholamines, and those catecholamines can actually slow or stall out labor. They've seen in animals that if an animal is in the process of giving birth, if they're scared, if something happens that frightens them, if they're really close to labor, they may just bleep that baby right on out. Okay, just get it done with. So that may be one response. But if they're not really close to delivery, it can actually stop their labor. Humans actually can respond the same way. So we can actually have labor slow down or stalled out because of stress. Anxiety also increases pain perception. If we're anxious, everything feels more painful. But also, if we have muscle tension because we're anxious, muscle tension actually physiologically causes more pain. And at the same time, the pain can cause muscle tension, which can slow labor and impede the progress of labor. So at times we have someone who's in so much pain and so anxious that maybe relieving their pain will allow them to progress better. The final thing I want to talk about is women who have a history of sexual assault or abuse. We don't really address this very well, but if someone has a history of being sexually assaulted or abused, the process of labor, there's a lot of sensations in the genital area during labor, or some of the procedures that are done in labor, like vaginal exams and breaking water and all of those things being on display in front of everyone may actually trigger flashbacks. In labor, especially in a hospital setting, we tend to have things hooked up everywhere, and so that patient may feel restrained or unable to move. That can trigger flashbacks. There are a lot of invasive procedures involving the genitals involved in labor care that can trigger flashbacks. And exposure of breast and genitals can trigger flashbacks and anxiety. Also, the loss of control of what's happening to their body. And that can be the labor process, but also a lot of times what we're doing causes that patient to lose control. So what can we do to help people who have a history of trauma? Well, we want to give them as much control as possible. We want to make sure we're letting them know and asking permission before we touch them, especially any kind of invasive procedure or exam. We want to be able to hear those thoughts and feelings if they need to express them. We really just want to be sensitive to that fact. And if you remember in our lecture about, or in our discussion of sexual and relationship violence, around 50% of the people in this class reported some sort of sexual assault, okay? Those numbers may be higher in the wider community. So you're going to run into a lot of people who maybe have never reported it, maybe have never considered that what happened to them was assault, but their body remembers that trauma and their body will respond to that trauma. So be aware of that when we're dealing with patients in labor. Okay, we're going to come back and start talking about the process of labor. We've talked about all the different pieces. Now we're going to put those together and talk about the process.